Good afternoon. It's not morning. It's already afternoon. Feels like morning. So I've always gone from regular hearings into an executive session. Do we open up an executive session or how do we?
I motion to move into exec.
All right. All those in favor say aye.
Aye.
Opposed? All right, we're in executive session. So we got a list. I think you all have a list. So I just want to touch on HB 63. I was ready to exec that today, and then I was reminded last night that I forgot to put in an amendment. So I've got, and I knew I was missing an amendment. I just couldn't remember which bill, and somebody caught me last night and said,
Wake up at 3 a.m.
yeah, well, it was more like 6:30, but PM. But so we're gonna wait on that. So let's go to HB 70. Relative to the use of electronic medical records. If we're going too fast, Sophie, let us know. All right. So this is a bill, based on testimony, I thought was largely unnecessary. I'm happy to get thoughts on that. I know it was prohibiting a requirement for electronic billing. We heard that our private payers in the state of New Hampshire don't require that. It is required for CMS and Medicare and Medicaid. So I think that it's.
I'll move ITL.
So I got a motion ITL. I'll second that. Any further discussion?
I just,
Yes.
very briefly,
Senator.
I always appreciate the work of
Been a long day.
Yep, I always appreciate the work of Dr. Nagel, but I feel that we've come so far with electronic medical records that we should focus on making the system better, not drawing back. That's all I want to say. Thank you.
Thank you. Any further discussion? All those in favor say aye.
Aye.
Any opposed? So the ayes have it, 5-0. Do I have a motion for
Consent.
consent? I got a motion for consent. Do I have a second?
Yes.
Senator Prentice is a second on consent. All those in favor say aye.
Aye.
Any opposed?
Oh,
No. I'll take that one out. All right, moving right along. 117, again, I have an amendment for that, but I want to check to make sure if I got it right, so I'm going to hold off on that for now.
Aye.
126, relative to prescriptions for certain controlled drugs.
Move re-refer.
We got a motion to re-refer. Do I have a second?
Yes.
Any further discussion? All those in favor on re-refer say aye.
Aye.
Any opposed? The ayes have it.
Consent.
I have a motion to consent for consent. Do I have a second?
Second.
All those in favor say aye.
Aye.
Opposed? So
want
it's
me to
on
take-
consent. You can take that out. Yeah. All right.
I was just gonna say, make sure. Oh, it's gonna be on consent, so as long as nobody takes it off, we'll probably need an explanation of why.
You want me to take it out?
No,
Okay. All right. But I'll happy to, if somebody takes it off, I'm happy to have that discussion with you.
okay.
House Bill 223. Senator Prentice, do you have a motion?
Yes, I have a motion for ITL,
I have a motion. Do I have a second? I'll second that.
and I'm happy to speak to my motion.
All right.
My motion for ITL has to do with what I found in the hearing, and it's been my experience that there's just not enough data to say that these different types of delivery methods, whether it's an urgent care, a birthing center, an ambulatory surgical care center in the more rural areas have been denied. There's a process for them to go through that I think the process exists for a reason, and if we want to focus on anything, we should maybe audit that process, but not eliminate it totally. And I will, for the record, say that I didn't find out till we were in this hearing that there is a dispute in Lebanon over an urgent care center, and I'd like to see that tightened up, but overall, I think we need to let the system as it is work, and that's based on the evidence that I heard, my opinion. That's why. Thank you.
So can I?
Yep, go ahead.
I am going to vote against the ITL because I just feel if you look at this map, as far as I'm concerned, a lot of these critical care access hospitals, they intersect with each other, so they're impeding. They're competing with themselves as well, and I think we're limiting the capability of urgent cares, birthing centers to be able to go in there. So I can't support an ITL.
I'm going to comment and really kind of expand on what Senator Prentice said, in that there is a process to allow competition into these radiuses, and this process was negotiated, and there was a compromise a few years ago. And in the research that I was able to do in talking with DHHS, it really, the mechanism forward really hasn't been utilized. So there's nobody that's been accepted, nobody's been denied. So perhaps if we find out this is truly a problem and restricting access to various types of care, we can revisit it. But at this point, I don't feel the need for 223. So is there any further discussion? The motion is ITL. All those in favor say aye.
Aye.
Opposed?
No.
So that's 4-1. Would you be opposed to consent, Senator?
No.
All right, so I'll make a motion for consent. Do I have a second? I'll give Senator Long as a second. All those in favor say aye.
Aye.
Opposed? And Senator Prentice, do you want to take this one out, or I can take it?
Absolutely.
All right,
Having lived and worked with critical access hospitals, happy to do it.
sure.
Yeah.
Yep. Let's see, 316, we're going to hold on based on, we've got some ongoing discussions that Senator Prentice and I were at this morning. So we'll hold on that. 357, do we want to take that up at this point?
I'm not to pass, so I don't know what you guys want to do on this one.
I'll move ITL.
So
second that.
we do have a motion and we have a second. ITL, do you want to speak to your motion, Senator?
Nope.
All right. We've got an ITL. Anyone else want to discuss 357? All right.
Well, actually, I do. If this bill limits childhood immunization requirements to disease identified in statute, it removes the authority of the Commissioner of Health and Human Services. So I think we heard in committee that that if there's a change in kind of the immunization, a tweak to it, then it would no longer be allowed because there's been a change to it. So there's a lot of things that I think are unintended consequences that would happen by passing this. So that's why I'm supporting an ITL.
I did have a question on this. If the commissioner doesn't write the rules, then who writes the rules?
I don't think there are any rules. I mean,
I can answer the rule writing question if you like.
Go ahead, Senator. Yes.
Thank you, Chair Rocheford. So, having written rules for a department before, not Health and Human Services, but the Department of Safety, the commissioner has the authority. Typically, the staff writes the rules, but the commissioner has to sign off on them. And I can remember before an extensive set of rules that I brought to Jellicar, working at the Department of Safety very closely with former Commissioner Barthelmess. He went through every single rule, every single stakeholder, every public hearing that we had with us before he signed off, and even made changes before we took them to Jellicar. So that's typically, they have that responsibility.
That was my question in committee, and I'm just thinking, I support the spirit of it, but the unintended consequences are like, it doesn't make sense.
Yeah.
Yeah, so I support the ITL.
So I just wanted to comment on that because I made some comments yesterday in the hearing that we had. the comments were, you know, the legislature has the ability and the discernment and the capability to make decisions. And I agree with that. I think the legislature does have that authority, and the legislature has chosen, in this case, to give certain authorities to the department to make decisions, which is our right to give it, and it's our right as a legislature to take it away. In hearing the comments in the hearing, you know, this vaccine schedule hasn't been updated in 20 years. So I don't think we have a overzealous department that is going outside of their boundaries. Looking at other states, what they're doing, we're very conservative in our approach to this. So I just don't think that this is necessary at this point.
And-
Just to piggyback on that, we have a system called GELCAR, which is the oversight of the rulemaking authority. So if something doesn't comport with what the legislature put out, then commissioner or no commissioner, if it doesn't comport to what the law is, then the rules will not be approved, and they'll have to go back and be reassigned. So it doesn't make sense.
There are legislative checks.
And
Checks and
balances.
balances.
Yeah.
Yeah, the other thing is when I did ask the question if the, because based on the testimony from the prime sponsor, he was saying that the legislature is going to be required to approve. And, you know, a lot of these vaccines are, you have to be pretty nimble about it. And I asked, you know, what if we're not in session and we need the vaccine? Well, then we can call an emergency session. It's still going to take a while, based on some of the previous emergency sessions we've had. So I just think it's not leaving us very flexible.
Even to that point, even emergency rulemaking, I believe, is like a 90-day window
Yes.
on top of legislation. You know, like
Yeah.
if you want to put an emergency rule in place, although considering how long it takes other rules to get approved, that's like, you know, that's still 90 days.
Any further discussion? Call the question. The motion is ITL. All those in favor say aye.
Aye.
Fine.
Any opposed?
Consent.
Senator Avard moves consent.
Second.
And Senator Long seconds. All those in favor say aye.
Aye.
Opposed?
Take-
Senator Birdsall has volunteered to take that one out. All right, moving right along. We can stay on vaccines if we want, on 358. This came to us, the prime sponsor said the impetus of this bill was to fix a previous bill that allowed for religious exemptions to vaccines. And he said this was brought about by Senator Lang, I believe Representative Lang at the time. And the hang up was that there's a form that's being used. And I understand how a form can provide some clarity or ease, you know, as in the schools when they use it, but there's no authority that this bill gave DHHS to develop.
And GELCAR never approved it in the state, and there's a state seal on there, so that there's implied consent that this is a state approved document, and it's not.
Yes, so I spoke to Senator Lang about this because this was his original bill, and he said, no, I did not intend there to be a formal process that parents would need to take a religious exemption for, and he supports this bill. So with that, I will,
And you want to pass?
we've got a motion ought to pass, and I'll second that. Now, there is a request for a committee amendment. And the committee amendment would read, Sophie, the exemption shall require no more information than and then insert the word written statement. Line 12,
Where did this come from?
that was a request from DHHS.
Well, that then, doesn't that then require that there's a forum?
No, just, I mean, you could sign a note. Parent could write a note saying, I have religious exemption.
Okay.
And if that becomes a problem, we will return to that.
So moved.
Yep. So we've got a motion. I'll make that second on the committee amendment. All those in favor say aye.
Aye.
Any opposed? So the
Move.
committee amendment passes 5-0.
Move on to pass as amended.
Senator Avard moves on to pass as amended. Do I have, oh, I think I seconded that, so I'll second that. All those in favor say aye.
Aye.
Any opposed?
Consent.
All right, 5-0. Senator Avard moves consent. I will second that. All those in favor say aye.
Aye.
Opposed? All right, that's on consent. Oh, I can take that one out. All right. So 377, that's from yesterday. I still haven't gone through all the materials from yesterday, so I'm gonna pass on that one for now. 548 relative to licensing requirements for healthcare facilities that operate on a membership-based business model. I will make a motion ITL.
Second.
And we got a motion and a second. Any discussion? All those in favor say aye.
Aye.
Any opposed? 5-0. I'll move consent.
Second.
Senator Long seconds that. All those in favor say aye.
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 Opposed? So it's on consent. Senator Long, would you want to take that one out?
I will.
All right, moving right along. We're going too fast, Sophie. All right. Let's turn to 559, relative to staffing requirements in emergency medical transport vehicles.
I have a motion.
Senator Prentice.
And I'll make my motion if I get a second. I'm happy to speak to it. Inexpedient to legislate.
I'll second that.
Oh, we got 2 seconds.
Okay,
I'll
so,
third it.
So I heard Senator Avard first. You can speak to your motion.
so here, and I was transparent that I have written these rules and enforced these rules back when I worked on safety. So there's no, like everyone understands where I'm coming from on this. It is clear to me from the testimony that if some communities are struggling with staffing, what we heard about, they're rolling an ambulance to get to a scene, to care for a patient, people are converging, meeting there, and then they're going to transport. You can roll an ambulance out the door with one person on it, or even have a firefighter drive it to the scene. That is if they're properly prepared, okay? But it is when you're transporting a patient, you need 2 people, 2 licensed providers, and I don't want to call it lowest level because that sounds disrespectful, but the entry level to licensed providers is like a 40-hour course, okay? And then you have to have at least an EMT in the back. So I respect what the representative was trying to do on behalf of her constituency, but I didn't see an overwhelming problem. They can roll an ambulance, they can meet people. Also, the data that they had, the Department of Safety gave me for now, this was during COVID and the 2 years after it, showed the utilization of with the waiver for a 1-person staffing model was like, 2%. 2 more things. One is, if this is such a big problem, there is rulemaking capacity at the Department of Safety on waivers, and it could be expanded to address this on a case-by-case basis, service by service, if they need to, if there's a big problem with one service. And the last thing that I'll say is that when Sully Sullenberger landed that plane on the Hudson River, do you know why 155 people got off of that plane? Because of crew resource management. Because the people that were flying and the people that were in back addressing the safety, because that's ultimately what flight attendants are there for, everybody knew what everyone's job was. And they knew what to do, and they all did it together. So I think we have a way for the Department of Safety to address waivers should they come up. I think that we know ambulances can roll out the door without 2 licensed providers, but get a crew before they transport. And I really think it's safety's in it. We want to be erring on the side of safety everywhere we go. That's what I'm going to say. Thank you very much. Dun dun.
Anyone else?
I know.
I
I had to
I
talk about
actually have
that.
a question that Senator Prentice.
Absolutely. Senator Birdsall.
Yes, Senator Burns.
So, if someone's having a heart attack, and they're in the ambulance, don't you need 2 people?
Yes.
One, oh, maybe I should have asked you. Senator. Don't they need 2 people in, one to do the,
Is your question, would it be preferential, should they have 2 people in the back and 1 person driving? That would be great. It just doesn't always work out that
so
way.
the 2 people is the one the driving?
One driving and then an attendant in the back.
And, because I don't think I was here for the hearing.
Yeah.
So would that mean that the person is in the driver's seat transporting and there's no one in the back to attend?
No, there would be 2 people on the vehicle, 2 licensed providers, one that was driving
Yep,
and one attending to the patient.
okay,
And that is the current licensure structure
all right.
that I didn't hear a compelling argument to move away from that current structure.
Okay. Got it.
And Senator Avard would like more people, but I think we're gonna have to just go with
I
the
had a
2.
great team.
I know, and let's let them, when they can, get that extra help.
I think there might have been 3 or I'm not sure. There had 2 firefighters and 2 people. Yeah, there were a lot. Of course, I mentioned her name, so they weren't going to drop me.
Yeah.
But I do want to emphasize that should the Department of should a community really have a problem, there is a waiver mechanism in place. And that, is at their disposal and can be done pretty quickly with the Commissioner of Safety.
Great, thank you.
You're welcome.
So any further discussion on 559? The motion is ITL. All those in favor say aye.
Aye.
Any opposed?
Consent?
Senator Avard moves consent.
Second.
Senator Long seconds. All those in favor say aye.
Aye.
Opposed? And Senator Prentice, would you take this one out?
Yes.
All right. So 606, again, that was from yesterday. I haven't reviewed that yet. Would like a little more time on that. If you want to flip to 679. Relative to immunization requirements.
I'm gonna move ITL.
Second.
My feeling is, well, my concern, let's put it that way, my concern is, again, so when you're, what they're looking for is to, provide that no child immunization requirements shall require a vaccine that has not been shown in clinical trials to prevent transmission of disease. Oftentimes, you don't know about the transmission of disease until way down the road. So that's my first concern with it. So, because it's a long-term results actually show whether or not it transmissions. Therefore, any new vaccines that come up are not going to be, we won't know if they prevent transmissions.
Right, I think what we heard in I really want to thank the prime sponsor for bringing this to us, because I think that she's clearly, involved in this situation and is passionate about it. I think some of the testimony that we brought up is that when a vaccine is approved, it's approved for safety and efficacy, and that's the how they define efficacy is not necessarily what's in the bill. So it would be it could be a we heard that there's some questions on how that would be interpreted.
And the other question I have is when you have an upgrade of a drug, does that have to go through another clinical trial? The one thing I did find obnoxious and is when you want a tetanus shot, you can't just get a tetanus shot. You have to have 3, and I don't understand why.
And I don't think that we can answer that question in this bill today, but,
Senator Prentice has a question.
Senator Prentice,
To Senator Birdsall's point, I've given plenty of DTaps over time, but I did ask Dr. Chan about that, and because I agree with you, like if you just want to get a tetanus, get a tetanus. And if I remember correctly, he said that, one thing for them right now was a supply issue. Like it wasn't always readily available just as that, because I heard your point on that loud and clear. But also, I don't know if it was him or there was a pediatrician that I was talking to, even though I'm far from the care of a pediatrician at 60 years old, that the getting the diphtheria and pertussis and at the same time, those two need, say, having a boost. It's like a boosting capability because the science has said that they may wear off more over time and would be able to boost. This is an opportunity to boost. So that, because I asked that question, there was not in the room, but outside of the room, and I believe it was a pediatrician, like, why do we have these all together? So I hear you. I agree on that.
I look at the fact that in November, I sliced my finger. I needed stitches. And they told me I should get a tetanus shot because I couldn't remember when the last tetanus shot. And I realize I probably didn't just get a tetanus shot. I got the whole full board. I'm sure they gave me information on it, but it's like, that's not what they told me. So that's irritating.
No,
maybe
yeah.
there's some opportunity there for
Always.
future discussion.
Yeah.
All right, so I've got a motion of ITL. Any further discussion? All those in favor say aye.
Aye.
Any opposed?
Aye.
That's opposition? Okay, so 4-1. You want on consent? Would you oppose to consent?
No, I won't.
I'll second consent.
So I'll make a motion for consent. Senator Long seconds. All those in favor say aye.
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 Opposed? So it's 5-0. Senator Birdsall, do you want to take this one out? I can take it out.
Sure.
I can take it out.
Senator Prentice wants to take it
Yeah.
out.
That'll give me 2 to take out
All
this
right.
time. I just don't want Sophie blocking me at the door.
All right, 701. We're not going to take up 701 today because that was yesterday. But interestingly, on my ride home, I had a constituent who was not watching the goings on yesterday. Said his wife has been traveling to Japan for the last 3 years to get a experimental cancer treatment using cells from her own body, and she has to fly to Japan because nobody's doing it here. And I said, I think this is exactly what we heard a bill that was addressing some of those things today. So we'll take that up at a later date. Same with 712, 732.
I would vote odd to pass on this one.
So is that a motion, Senator?
I would like to make that motion. I know that there might be some opposition to it, but anything that strengthens parents' to inform parents and allows more accountability. I like that idea.
Do I have a second?
I think I have one.
I don't hear a second, Senator. Sorry. I'll move ITL.
Second.
In a second, and I will speak to that, and I'll address, I think, hopefully some of your concerns. Is I, like you, I don't have any. I think more communication with parents is better, but the problem that I see with this is specifically the definition they use for psychotropic drugs is a little questionable. They use psychotropic drugs and shall include stimulants, including ADH drugs, such as, so that, it kind of leaves an open-ended question for me with that. The other issue I had with this is just for Medicaid patients. So you've got a doctor now who may be prescribing this stuff and they might not have any access to what their payment method is. And now they're like, well, how do I don't know if this is a Medicaid patient. Is it not a Medicaid patient? So those were the two breakdowns that I saw.
Should we amend it to make it for all patients?
Well, that's the other thing. In a lot of these drugs, these handouts are already being given out, not only at a pharmacy level, but also in an office. So I hear your concerns, but you haven't got me there yet.
That's
Okay. Any further discussion? Motion's ITL. All those in favor say aye.
Aye.
Opposed?
Aye.
We got 4-1. Did you oppose consent? So I'll move consent. Senator Prentice seconds. All those in favor say aye.
Aye.
Aye. Opposed? And I can take that one out. And that concludes our list for the day. While we're in executive session, is anything else we want to talk about while we're here?
Just that we should hold on to this list for what else we need to, Zach is on it, right?
Yep.
And then when do you, what's the,
We're not meeting next week, but probably the week after.
okay.
I know we're not going to be executing the bill, but we did hear some information yesterday, which I thought was kind of troubling with regards to the coding, and I would like more information on that. On the last bill that we listened to, the F-28 or whatever that was, regarding the coding. I think it's a serious issue that needs to be resolved because we need to discern what's going on.
Well, I can give you an update on that. So I, like you, was shocked. You know, we were told that this isn't happening. And then we had somebody else come up and testify, well, we have billing codes that show it is happening. We were just at the Department of Insurance earlier today, and we're going to be requesting that the Department of Insurance provide us with any information, or I'm going to be requesting that as far as running those codes to see if those codes are actually running through the system, and you know, try to get to the bottom of that.
It's important because, oh, I'm sorry.
Senator Prentice.
Oh, don't, go ahead
All
and then
right.
I'll
All right.
wait.
And I appreciate you doing that investigation because there, you know, for the public's benefit, you know, people can come in and make a claim.
Right.
And then somebody can say, well, that's a false claim. And so we're in a dilemma
Right.
based upon that. And so we need to verify this. And if it is happening, then we need to do something about it.
Yeah.
And just because, so having, you know, a person come in and say, you know, in the public hearing that this is happening and that Dartmouth Health is doing it, and then have Dartmouth Health have offered in their testimony and then came back in and say that they're not doing this. We're all, so
Right.
I did have a conversation with Dartmouth Health because he said, you need to run this to ground because that's like, so I think between the Department of Insurance and Dartmouth Health, it will give us the adequate data to understand.
Yeah. I mean, that's a very serious situation if we were given false information.
Yeah. Agreed, and that's, so and who the accusation was made at should be part of the conversation,
Yep.
so. you know,
Yep. No
Yeah.
doubt, but
And they, yeah, so let's let them roll. I'm glad you talked to the Department of Insurance, because
Yeah.
the all claims database.
That's when
is-
he said that this morning, I
Exactly.
said, that's, I never thought of that yesterday.
No, I didn't think of it either.
No, very good. Oh, any other things we need to talk about? I'll take a motion to come out of executive session.
Second?
All those in favor say aye.
Bye.
Opposed? We're out of executive session, and having concluded the business of the day, we will adjourn.
Ooh, you were right.
Good
I
job.
was worried.